Women with disabilities leading the fight against gender-based violence during the pandemic.
What I would like to share with the community or the society around the world, at everybody listeners, listen, women with disabilities. It is so important for the world. I remember research for the World Bank that women with disabilities suffers 10 times more aggression for girls and women without disabilities. And for me, it's so strong. It's very strong.
Gender-related violence did not come suddenly in connection with COVID-19. This is a real problem that has existed before and will continue to exist.
In 6 countries, disabled women activists are leading innovative changes to ensure gender-based violence services during the COVID-19 pandemic are inclusive.
I am Mila from Brazil. Because women with and without disabilities experience increased violence during the pandemic, we are working with feminist organizations, the police department, healthcare, and the social assistance professionals and women with disabilities to develop coordinated responses to gender-based violence.
I am Ekaite from Nigeria. Because disabled women need access to information about gender-based violence, we are conducting a workshop with disabled women, government agencies, and GBV service providers to develop guidelines for inclusive GBV interventions.
I am Mose from Haiti. Because so many GBV services are not inclusive of women with disabilities, we are promoting a virtual awareness campaign on key actions to take to adapt GBV services to include women with disabilities.
I'm Manik from Sri Lanka. Because majority of women with disabilities live in rural areas and they do not get information in accessible formats, we are developing the Be Safe mobile app to share information about responding to gender-based violence and where to access services.
Most of the women and girls with disabilities from the very grassroots level did not know where to get GBV services and how, if they are victimized on GBV, what to do, where to put complaints, and what are their rights. Now they are sensitized on all these services.
I am Duya from Mongolia. Because disabled women need access to information during this pandemic, we're creating a handbook on accessing resources for women who have been affected by gender-based violence. There are many textbooks and manuals on reducing gender-based violence and ensuring gender equality in our country. However, it does not specifically address the issues of women with disabilities. We have tried to solve the problem with this guide.
We don't train there as well.
Ramatu Princess Kane from Sierra Leone.
We have done trainings on how service providers should relate with persons with disability and how women with disabilities can come boldly to report on any issues where it affects them in human rights areas, so they can feel free knowing that they are included in those services.
This project not only enabled the funding to go to the disabled women leaders, but it enabled all of us to work together and to share ideas together. So my message would be, this has to be the beginning of something very different. That every time there's funding for GBV, for women's issues, for getting vaccinations during COVID, whatever it is, it must go to disabled women leaders. This project has proven that it works, that the communities are changing, that disabled women leaders are feeling more powerful, that they're being heard, that disabled girls can look up to these disabled women and see the change that's happening. that this project has to be a catalyst for changing how we fund things, who is on the planning committees, and how we all work together. We are women with disabilities, and this finally has been a project to say, let us start doing things differently. Let us let disabled women lead the way.
For me, as a woman with a disability, I was able to, make a big noise among other women and women organizations and women networks that we as women with disabilities could do a lot to bring a change.
In making the video that we have done with women leaders in the disability community and working towards gender-based violence reduction, that process of making the video was incredible. And we realized that we as women with disabilities can lead and that we can take on so much work.
For me, this project was the opportunity for all these stakeholders working in the GBV sector to know exactly what they should do or what they can do to make their services accessible to women with disabilities victims of GBV.
It's time for governments, civil society organizations, and anyone concerned with gender-based violence during the pandemic to do things differently. Here are some actions you need to take to ensure your programs are inclusive. Ensure offices and shelters for abuse survivors are accessible. Add ramps, handrails, and accessible toilets. Circulate information through various formats, such as audio, video, images, text, braille, and sign language interpretation. Set up text messaging systems to make GBV hotlines accessible for deaf people. Dedicate funds in every budget to make activities accessible for people with disabilities. Train your staff on the rights of people with disabilities and how to recognize signs of violence specific to people with disabilities. For example, violence perpetrated by caregivers or family members. Most importantly, partner with disabled women and disabled women's organizations. Engage women with disabilities as an integral part of planning and leading GBV initiatives.
Women with disabilities, it's together change the world.
Disabled women leaders leading the way.
Disabled women leaders leading the way.
Disabled women leaders leading the way.
Women leaders with disabilities are leading the way.
Disabled women leaders leading the way.
To ensure your programs and organizations are including disabled women as leaders and beneficiaries during the pandemic and for the future, contact Mobility International USA at miusa.org. Featuring disabled women activists: Mila Guerres, Brazil, Aimé. Mose Francois, Haiti, Fille à la besoin spéciaux pour la réforme, Fibers. Dulceram Jigjid, Mongolia, Cultural Center for the Deaf. Akate Umo, Nigeria, Family-Centered Initiative for Challenged Persons, FASIP, Disability Plus. Ramatu Princess Kanu, Sierra Leone, Women with Disabilities Yearning for Equal Opportunities. Mani Gunarante, Sri Lanka, Employers Federation of Ceylon. Susan Siegel, United States, Mobility International USA. Created by Mobility International USA. Produced by Capelli Miles. Music by Reginald Robinson. Select photos and footage courtesy of Darcy Keyfield and local partners. Copyright Mobility International USA 2021. All rights reserved by MIUSA. Do not use, reproduce, download, distribute, alter, or transfer any part of the video or images from this production without MIUSA's prior written permission.